observance of National Infertility Awareness Week, today we have Dr. Partha Das from Orchid Fertilities in Dubai to help us understand more about infertility. Dr. Partha Das is a Deputy Medical Director and Consultant in Reproductive, Endocrinology and Infertility at Orchid Fertility in Dubai and visiting IVF Physician at UHS Sharjah. He has 19 years of experience dealing with complex infertility, genetic and gynecological cases, and he has helped many couples achieve parenthood with great success. Dr. Das obtained his master's in assisted reproduction, embryology and genetics from IVF Valencia, Spain, and further advanced his skill sets in reproductive medicine from USA and Germany. At the platform of Being She, we make constant effort to bring experts to talk about the relevant topics and to raise awareness. It is our pleasure today to welcome Dr. Partha Das to talk about infertility. Welcome, Doctor.
Thank you so much for having me here today.
Our pleasure. So to begin with, Doctor, what is infertility?
Infertility, as per the World Health Organization, it has been classified as a disease of the reproductive system. So inability to get pregnant after 1 year of unprotected intercourse, specifically for age group less than 35 years of age. But if the lady's age is more than 35 years of age, then 6 months of trying, and if she's not yet been able to achieve a conception, so that's called primary infertility.
All right, okay. So here is my second question, which is very important. I always feel, that because people think that they have been pregnant once or they have, had a baby once, is it still possible for them to be infertile?
Yes. Many a times we have seen our patients coming in and they tell us that, we have had no problems, in achieving our first pregnancy. But it's been 3, 4, 5 years now, and I'm still struggling to, complete my family with my second child, and I really don't know why is it so difficult. So yes, after having a successful first pregnancy, you could be still infertile, and that's what we say is a secondary infertility.
All right. Okay. So what are the ideas or the suggestions to improve it, that according to the medical science?
In today's day and age, we have understood one thing, that maternal age or advanced maternal age is number one criteria which dictates a successful fertility outcome, and that is because of the diminishing ovarian reserve. So if after a successful first pregnancy, if the couple has not been able to achieve conception and they want to take it to the next level, they should see their primary physician for an evaluation check to ensure that the hormones are good. By scans we can see the endometrial lining, the uterus is good, there is no endometriosis, there is no fibroids, and of course we can check the number of follicles and eggs left in the ovary, which is a marker of ovarian reserve. And there is a test, specific test, which we say is a AMH, anti-Mullerian hormone, that also can be done. For the husband, we can do a basic semen analysis to ensure that his semen count and motility and morphology is good. So, These are the basic ABCs checks that we usually do in a fertility clinic.
Okay, good. So does age affect infertility?
Absolutely, yes. That is a main determinant of a successful fertility outcome, because the eggs age inside the ovaries. So doing things at the right time is the final predictor of a successful fertility outcome.
But what happens to a woman or a girl or a lady because of the situation or circumstances? She cannot, she just misses the bus or the age or the time. Then what are the,
Yes, you have asked me the right question, because this was the talk once upon previous years. But nowadays, with advancements in our science and technology, we have changed that narrative. The narrative being today, if because of career reasons or because of education reasons, somebody who's not yet married, they want to pursue their education or career, but at the same time the ovarian reserve is the clock is ticking, what they say, then she doesn't need to worry at all, because she can safely go to a fertility center and she can harvest those eggs out and freeze, and these eggs can be frozen for 5, 10, 20, 25, 30 years.
Wow.
Yes, so and when she is ready to take it to the next level, she can go back to the clinic and take those frozen eggs out, fertilize with her husband's sperms, and she can still have a child at as late as 38, 40 years. by using the eggs which she has done at 32 years.
Amazing. And this is all a safe procedure.
It's absolutely safe because our science and technology has improved, and nowadays we are doing it. Even it's not about eggs. The couple who doesn't want to have pregnancy right now and they want to focus on something else in their life, so they can also come in. They can do their fertility programs like IVF, freeze the embryos, store it in the freezer, and then they can go and do their personal or career aspects of their personal life. And then when they want to come back after 3-5 years, they can always come back and replace those young embryos and have a successful fertility outcome. So nowadays, this aspects of, that I am not able to get pregnant because I didn't get married or I did not get the right husband or whatever, this narrative has changed now because of the eggs
medical science have really improved, and it has advanced a lot. I mean, I'm so amazed to know this fact because I was not aware about this situational thing at all, that there are so many options, and there are so many ways that we can still achieve what we want to.
Yes, and we, in today's day and age, we need to talk a lot, we need to discuss this, we need to come out in the platforms and tell what is right and that it is absolutely safe to do it.
Amazing. So that brings me to a very important question, that what happens during fertility consultations in Czech as a process?
So I would say what I did just 3-4 hours back now when I was doing a consultation. So when the couple comes into a clinic, we sit with them and discuss about their past medical history, what they've undergone, what test has been done on them, and their treatment aspects done elsewhere. We analyze them. Then we take them through the journey of life, like what happens in the normal physiology of reproduction. And then once we understand what is normal, then we will be able to understand where all things are missing out. Like, is there a problem with the ovaries? Is there a problem with the uterus? Is there a problem with the tubes? Is there a problem with the hormones? Or is there a problem with the sperms? And accordingly, we acknowledge those, we try to tick those boxes, we try to rectify those, and then plan and individualize. That's the word I'm using, individualize or personalize the treatment option for the couple. If they need artificial insemination, we do the artificial insemination. If they need an IVF program, we do the IVF program. If they need a pre-implantation genetic screening of the embryos because of, let's say, repeated miscarriages, then we do those things. And these things are discussed during this initial consultations. We do a scan, we show live pictures of the uterus and ovaries to the patient, and they are made a part of this whole consultation. And only once they have understood every bit of it, then we decide to take it to the next level.
So I'm sure that any couple or any lady who's going through this procedure, she needs a lot of emotional and mental support from the consultants as well, and you being the main point of contact for them and the doctor. So how do you deal with their emotional and mental well-being at that particular time?
This is where our ethical principles comes into play. We at the end of the day, we are human beings, and we should not forget that it is a human to human interaction that we need to do. These are the couples, these are the patient who comes with a lot of negative emotions behind them, with a lot of stress behind them, with a lot of failures behind them. We need to approach this in a very sensitive manner. We need to discuss. We cannot keep shy, or we cannot just keep quiet about it. Or we cannot just say it's okay. We need to talk about it, and we need to tell that you are not the only one. There are many other ladies who also has gone through the same, and they have tried this kind of treatment options and they have been successful. So when they hear this kind of successful stories, they open up. So we, as fertility consultants, we are also counselors in one way. We need to sit, we need to address these issues. And if we feel that the couple needs really a thorough psychological counseling, then we do have the advantage of referring them to our psychologists, counselors, to have a detailed chat about this those silent episodes of the stress factors which is bothering them, and it helps them. So as a holistic approach, we do try to sort these issues out at every level. And it is not a one-day's job, because this couple, they come into our clinic every week or every other day, and we take every day as an advantage day for us to sit, talk and discuss. And trust me, we have been successful a lot in this, and our couples and our patients are very happy.
That's great. So thank you so much for throwing light and raising so much of awareness about this particular topic because I really feel that there's a lot to be spoken about.
Yes.
A lot of awareness that should go among the community.
Yes.
And the women or the couples who are in need should get the right contact.
That's right. Fertility treatment, it is a very what I would say, a very safe treatment. A treatment, if done at the right time, gives us a lot of success.
Right.
Many people are very shy to even talk about it. They stay very quiet because they think that doing an IVF program or doing an IUI is something which the society will look down upon, but it is not so.
Yeah.
It is not so, people, because if today you take this treatment advantage and you end up having a baby, that's it, you have completed your family. So it is our duty as healthcare providers, as fertility physicians, to raise this issue and talk about it, spread this information in the community, that it is okay to
it is as normal.
Yeah, it is as normal. Like today, if I have been diagnosed with some kind of disease or ailment, I have to go to the doctor. Like if I have been diagnosed with a kind of a malignancy, I have to go to and take a chemotherapy or radiotherapy or some kind of a treatment or a surgery, or take some antibiotics to treat. So fertility treatment is also a disease process, and we need to eliminate those processes and try to make a life. And
it has to be more inclusive now in our lifestyle.
Yes.
So guys, here we are with Dr. Partha Das, who has huge experience and many success stories where he has given the pleasure of parenthood to many couples. And it's the time to talk about it. As I always say, that knowledge has no gender. So it's my pleasure absolutely today to be meeting with you and having this interview to raise a lot of awareness about the infertility issue during this National Infertility Awareness Week. Thank you so much once again.
Thank you so much for raising this issue and discussing it out. These are the talks which it translates out in the community, and I'm sure our community and society will benefit from this.
Definitely, I hope so for the same.
Thank you so much.
Thank you
for your time.